It was just like injecting sodium hydroxide in somebody's bloodstream. You really have to know what you're doing. In Europe, one of the prescription products is lipoic acid plus trometamol. Are you familiar with trometamol? This is a hydrocarbon that dissolves the lipoic acid in a neutral state. And this can be given to people intramuscularly, but it's at a very low dosage. It's like 25 or 50 milligrams per cc. So you really can't get up to the high doses if you inject it IM. If you try to inject regular compounded lipoic acid IM, you're going to swell up the person's rear end and cause a lot of pain. If you do it intravenously, you could kill somebody. And you can't mix lipoic acid with anything in an IV bag because it will cause precipitation. It has to just be lipoic. You mean the pH of the alkaline solution? I'm not sure, but it's high. With the people we've had with pancreatic cancer, with certain neuroendocrine aspects, carcinoid aspects, these people, from my experience, seem to do the best on this protocol. But what I would do is first see what the big medical centers can offer you in an A level. Okay. Well, we have very good results with that kind of a thing, but our patients with that type of pancreatic cancer, this carcinoid, when we send them to oncologists and they put them just on somatostatin A, they may do well for a while, but then the cancer comes back. And with the low-dose naltrexone plus lipoic acid, as long as they're doing this, with some of our patients, they've gotten completely well. I work with an oncologist in El Paso, Texas, quite a bit of the time, and a local one too. And they're amazed at what's going on here. What I said is, if somebody's really sick, we encourage them not to come. But if somebody can travel and is feeling good, feeling fairly normal, we're usually glad to see them. And we always give the recipe for what we do to your local doctor or a doctor in the community who might want to continue it. Well, I think that most people, when they have pancreatic cancer, go to a large medical center, and the common treatment is gemcitabine, and maybe another chemotherapeutic agent. And personally, I've never seen it work for anybody. And they often get sicker and are told to go to hospice. And some of these people arrive at our office. I think we get the worst people. And I don't encourage anybody not to get chemotherapy. Say, talk to your oncologist and then educate yourself on the various treatments. And if chemotherapy, if they say, 50% of the people will do well on chemotherapy, I say do it. But if they say the chemotherapy may help you for a while, and maybe in a few months, may give you a few months, say, well, I would try something else, but it's up to you. I don't think the doctor is the boss, it's the patient. And a wise patient educates himself. Many doctors thought that certain types of autoimmune disease had some bacterial involvement, such as a mycoplasma or a chlamydia, an intracellular bacterium. And many rheumatologists have found that by adding an antibiotic often makes people feel better. That's why I do it, and I found that to be true. I usually will start with minocycline, 100 milligrams a day. Make sure they take an acidophilus probiotic. And after a while, it doesn't seem to work as well, and I change to something like erythromycin for a while, and then I go back to minocycline and maybe erythromycin. 2-week stay is always better than a 1 week. I would count on it. We had a few years back, we had a gentleman come from Senegal, and he was the Grand Khalifa in Senegal, and he came with his bodyguards and his cooks and his wives and the whole group. Like, he had first gone to a hospital right here in the Washington area, very prestigious place. They told him they couldn't do anything for him. To go back to Africa, you're going to die. And one of the doctors there told him, go to New Mexico, I think he could help you, but don't tell anybody at the hospital that I told you because I'll get fired. And he stayed for 3 months. When he came, he couldn't walk. He had severe diabetes. He couldn't walk because of the neuropathies. He couldn't read because of the retinopathies. In 3 months, he was reading again and walking. So I think he stayed the longest. But people usually stay from a week to a month. And then we've had many people move to the Las Cruces area because they couldn't get treatment anywhere else, and they live there now. Lipoic acid also modifies gene expression by interfering with various transcription factors, the best known as NF-kappa B, which turns on the growth of cancer cells, which causes the cancer-type inflammation. And in that way, it seems to retard the growth of cancers. It also restores T cell function. This has all been proven. If you go to the National Library of Medicine website and you type in lipoic acid, you can see thousands of studies, abstracts of thousands of studies, and the various things it could do. If you go to Google and you type in lipoic acid, you see lots of information and some actual full-text publications in this area. If you go to Google and you type in Berkson, B, M like Martin, many of my full-text publications will pop up in various areas in microbiology and medicine, different areas, cancer. Nobody knows these things for sure, but I know it modifies gene expression when you treat a person with cancer. And I don't know how the body knows, but I suspect it doesn't cause new angiogenesis in cancer cells. We follow these people every couple of months with CAT scans or PET scans and laboratory work, and it's an ongoing process. I have one professor who comes in with spinal stenosis and cauda equina syndrome, where you get numbness in your buttocks and partial paralysis of the legs and paresthesias in the legs. And he claims this is working for him. He's just on low-dose naltrexone and a nutrition program. Some people like it for osteoarthritis. I don't know if it works or not. But for the autoimmune type syndromes, like ankylosing spondylitis, theoretically it should work, and we have a few people that it seems to be working on. I don't know.